Your heart has a rhythm, one it's supposed to follow, typically between 60 and 100 beats a minute. But when that rhythm falls out of step, it can change everything.
Heart rhythm disorders, or arrhythmias, can cause symptoms many people ignore. News Channel 7 spoke with a doctor at the Cardiovascular Institute of Panama City to break down what's normal, what's not, and why early care matters.
A heart that beats too fast can leave you lightheaded, dizzy, out of breath, or feeling fatigued. Others might feel chest discomfort or something harder to describe.
The symptom for arrhythmia usually is palpitation. Palpitation could be raising heart sensation, or it could be a skip beat sensation.
Certain fast-paced arrhythmias can be dangerous. While most can be helped with medications or ablation procedures, some could require defibrillation to stop them. But some rhythm disorders slow things down. For people with a heart rate that's too slow, the solution looks different.
The most common treatment for slow heartbeat is pacemaker, because we don't have a medication to increase the heart rate except the IV medication.
As we age, the risk changes. More people in their 60s and 70s develop premature beats. While they can begin benign, ignoring symptoms can have consequences.
If the symptom of the rhythm disorder not treated correctly, it can develop weak heart, it can develop severe consequence, for example, syncope, or it can develop further other arrhythmia.
Even with all the treatment options, doctors say the best approach is still prevention.
We recommend people follow diet, low salt diet, exercise regularly, 30 to 45 minutes every day.
Because at the end of the day, your heartbeat isn't a rhythm you want to ignore.
Medical Monday is sponsored by Cardiovascular Institute of Northwest Florida, providing nationally certified cardiovascular services right here at home.
Doctors say if you notice palpitations, dizziness, or unusual fatigue, don't wait. Check with your family doctor. You might just need a referral to a cardiologist.